Hello everyone, good morning my dear student. Myself Dr Mahesh Kumar and today my lecture on topic anatomy of breast. As you know that the breast is situated at anterior aspect of chest wall overlying the muscles, pectoralis muscles. The breast is found in both sexes, in male and female both, but rudimentary in male. It is accessory reproductive organ in female. The milk secreted from the mammary glands provides the nutrition to the newborn. How the breast development occurs? The breast appears in the sixth week of fetal life, means intrauterine life, and its appear as a ectodermal thickening on milk line at the mammary ridge. During puberty, estrogen help in development, and during pregnancy, progesterone and estrogen helps in development. Changes in breast size occurs in pregnancy, and in breast branches of lactiferous ducts occurs during the menstrual period and the pregnancy. The size of the breast depends upon the accumulation of fats in the breast tissues. Now the anatomy. The breast is a modified sweat gland, lies at the superficial fascia of the pectoral region. Its extent is in vertical positions extends from the second rib to sixth ribs, and in horizontal position it extends from the lateral border of the sternum to the mid-axillary line. The anatomical structure axillary tail or axillary tail of Spence is a small extension, pierces the deep fascia through foramen of Langer, lies in the axilla. A well-developed axillary tail occasionally may be mistaken in large lymph nodes or lipoma. The deep relations of the breast. The breast lies on the pectoralis major, pectoralis minor, a part of the serratus anterior and a part of latissimus dorsi. It located deep to pectoralis major. The pectoralis minor muscles is enclosed in clavipectoral fascia. The retromammary space. The retromammary space is loose areolar tissue. The breast is separated from the pectoralis fascia by this. These spaces have lymphatics and small vessels. The retromammary space helps in freely movement of breast over the pectoralis major muscles. During the mastectomy process, the breast is separated from the pectoral muscle in the plane of retromammary space. So this help in while excision of breast in disease stage done. Now the structure of the breast. The structure of the breast is described under the following headings: skin, parenchyma and stroma. Now the skin surface includes the nipple and areola. The nipple is nothing but in conical projections situated just below the center of the breast at the level of the fourth intercostal space in mid-clavicular line. It is a erectile structure, contains smooth muscle fibers arranged concentrically and longitudinally and covered with thick pigmented skin which increase during pregnancy. The nipple near its apex lies orifices of lactiferous ducts. These ducts are about 15 to 20. Another structure in the skin is the areola. Its epithelium contains numerous modified sweat glands and sebaceous glands at the areola site. The sebaceous glands enlarge during pregnancy and serve to lubricate the nipple during lactation. This is the Montegrey Tubercles. It contains involuntary muscles arranged in concentric rings as well as radially in the subcutaneous tissue. Now the another structure is, after skin, the another structure is parenchyma. The parenchyma, a mature breast is composed of two principal types of tissues, glandular tissues and fatty tissues. The glandular tissues helps in the milk formation secretions, and the stroma is the fibrous tissue and fatty tissue. The glandular tissue consists of 15 to 20 lobes connected together by areolar tissue. The lobes of the breast parenchymal tissue is each lobe is a cluster of about 110 to 100 alveoli of lobules. The lobules are basic structural and functional unit of the breast, and these lobules empty via ductules into the lactiferous ducts. Now the next one is the lactiferous duct. These are the 15 to 20 in numbers, which are lined by a spiral arrangement of contractile myoepithelial cells. Noted that contractile myoepithelial cells. These lactiferous ducts arrange in a radial fashion and exit through 15 to 20 orifices on the nipple surface. The lactiferous sinus or lactiferous ampulla serves as a reservoir for milk and abnormal discharge. Means that the milk and abdominal discharge may reserve or stored at the sinus, lactiferous sinus site and ampullary sinus. So these structure have clinical importance. These figures are shown at the right side. The another structure is the stroma. In the breast, it forms the supporting framework of the gland, and it is partly fibrous and partly fatty. The fibrous part or fibrous stroma forms septa called the suspensory ligament of Cooper. These ligaments are hollow conical projections of the fibrous tissue filled with breast tissue. The apices of these cones are firmly attached to superficial fascia and thereby to the skin and to the pectoral fascia. The arterial supply of the breast. Three major arterial supply occurs in breast tissues. This is the internal thoracic artery by the medial mammary arteries. The second is the axillary arteries, and this is superior thoracic, thoracoacromial, lateral thoracic and subcapsular structures. The perforating branches from intercostal arteries, the second, third and fourth intercostal arteries. Now the venous drainage. Superficial veins at skin and superficial fascia drain into internal mammary vein and axillary vein. The axillary vein, internal thoracic vein and second and third and fourth intercostal veins. Intercostal veins communicate with the vertebral veins. Now the lymphatic drainage of the breast. The lymphatic drainage, the subareolar lymphatic plexus drain into pectoral lymph nodes, which drain into axillary lymph nodes, and these drain into subclavian lymphatic trunks. These pathway drains 75% of the lymphatic tubes. The next one is the subareolar lymphatic plexus, the paraexternal lymph nodes. The subareolar lymphatic plexus drains into paraexternal lymph nodes, which drains into bronchomediastinal lymph node lymphatic trunks. These include the 25% of the lymphatic drainage. The axillary lymph nodes, posterior or subcapsular group situated on the posterior axillary fold in relation to subscapular vessels. The lateral or brachial groups situated on the lateral wall of the axilla in relation to axillary veins. The central group embedded in the fat of center of the axilla. The lymphatic obstruction in advanced carcinoma breast finally results in the pudgy orange features, cancer in QRS, lymphangiosarcoma and late edema of the arm. These are the complications seen in breast carcinoma patients during the advanced lymphatic obstruction phase. The specific nerves, the long thoracic nerves of Bell or nerve to serratus anterior injury causes the binging of scapula. The thoracodorsal nerve, nerve to latissimus dorsi, usually preserved during axillary dissection but can be sacrificed if it comes in the way of dissection. The intercostobrachial nerve, cutting of the nerve causes cutaneous anesthesia in inner side of the arm and axilla. So the long thoracic nerve of Bell, thoracodorsal nerve and intercostal brachial nerve related with the breast anatomy. The common diseases of breast seen is the congenital anomaly like emastia, polymastia, polythelia, athelia, mastitis. This is mastitis and breast cancer inflammatory disease of the breast, that is acute mastitis and chronic mastitis both. The other one is the tumors like fibroadenosis, fibroadenoma may be benign tumors, gynecomastia, and other is the malignant tumors, that is carcinoma of the breast. The congenital anomalies include the emastia, polymastia, athelia, polythelia, etc. Thanks for your patience listening. Your queries and suggestions are welcome. Thank you. Thank you so much.